Hi everyone! So today we have a piggy called Luna who has come to visit us along with her gorgeous owner Aileen. Check out what went down when we discussed some ovarian problems that she has. This is something that does crop up with guinea pigs, female guinea pigs, from time to time, and you need to be aware of what to look for. So enjoy! Look at her! What's her name again?
Luna.
Luna, that's right. Come here, Luna. Oh, she's very big, isn't she? Yep. Yes. Here we go. Luna, look at you, yeah. So we have got Luna here, and Luna has been diagnosed with polycystic ovaries, which means that the ovarian cysts, which are located down in the abdomen, are filling with fluid. And as they fill with fluid, they enlarge, and what we notice with piggies, it becomes really uncomfortable for them, and over time it starts to inhibit other things like breathing, because their abdominal cavity is becoming so large that their breathing capacity is reduced a little bit, so it increases other things. They're also gaining weight because they're carrying around a lot of fluid, so it's harder to move around, more difficult, a bit like a heavily pregnant sow might be, with the exception that it's a natural process. With ovarian cysts, it's not necessarily so. She's just arrived in. Her little poop is quite small in size. What have you been noticing with her in the last few days? She's on a few meds. Why don't we talk about that?
Yeah, so I brought her to the vet a couple of weeks ago, and she's taking Moxilin.
Oh, meloxicam?
Yeah, that's that one.
So that's a pain relief, yep.
That's right. And with anti-inflammatory, is that right?
Yeah. Well, it is an anti-inflammatory.
Okay.
Yep.
And she is taking that once a day, 3 ml and 15 ml actually. And since that, she's been really quiet.
Yeah.
She's been really quiet, and she's not moving much around. In the last 3 days, she probably didn't eat as much. She goes in front of the food and she just smells, eat a little bit, and then she stops. And she seems very uncomfortable, very sleepy. Her eyes closing very often at the moment, and she seems she seems in pain, actually. That's how I feel like, and she's not moving and running around. She's on the same spot over and over again. Unless I give her water, she doesn't drink, but every time I give her water, she drinks a lot. She is thirsty and she is hungry. She just don't do it.
And how old is she?
She's 5.5.
5.5, okay. All right, with ovarian cysts, and you can see that the area that she has here, she really does look as though she's pregnant, heavily pregnant. So they are really impacting her enormously. And the other observation is her breathing. So when we look at a guinea pig that is struggling with breathing issues, they don't have an even flow, rise and flow, that we can monitor. And if you actually try and breathe in line with how her coat is here, you can see she's like huff, huff, huff. It's almost like she's running a marathon. So that's how she's feeling at the moment, which matches her being tired with what you're saying, because she's already running a marathon just by sitting still. And you can actually see how much she's actually heaving with that, whereas it should be a nice even pattern, and she's certainly struggling. So I'm just going to listen to her, because there could be more going on. It's important with something like this that you support fully the weight when you lift her, so like lifting all of her. She's carrying a lot there. Okay, so her breathing is even and clear, which means we can rule out, in addition to the ovarian cysts, a respiratory infection, which is good. So we're not dealing with that. What she's exhibiting is really probably the latter stages of the ovarian cyst development. Now, when they become so large, think of them like inflated balloons, and they can potentially rupture. Now, if that happens, you've got real problems. It's life-threatening, and in many cases euthanasia is a kind option because of the contents and how they rupture into that area. So it's a good idea to try and get before that. Now, with ovarian cysts, there are two typical treatments that they look at. One is the surgical removal of the ovarian cysts, and we see the surgery with that. They're quite large when they bring them out, and she has certainly got very enlarged ovarian cysts there. The other potential option is to drain off the fluid that's there, and just looking at her, there would be roughly 30 to 40 mils of fluid on each side, so that's considerable. They can actually do that by aspiration, which is where they put a very fine needle in and they take the fluid off. It's a clear fluid, so they can actually remove that.
And that doesn't explode like if you pinch a balloon?
Well, it makes it weaker on that side, and the question is how quickly will her body then refill it? Because literally, if it's refilling within days, then it does, the aspiration of the needle, it's actually so tiny, so thin, doesn't make a huge difference because the wall is quite fine and it's supported by the outer area of the abdomen. So if you think of a balloon within a balloon and it's the inside one that has got the fluid, then it's got some protection, if you like. If we were talking about an abscess and we had the vets, this is nothing to do with an abscess, but let's say we have an abscess that's a big growth area full of pus and gunk that needs to come out. If they aspirate that, the pressure in that literally then will come out that side. So even if it's a small little area, it'll continue to ooze out through that point. So they can actually do that with ovarian cysts. There is some risk to it, that they need to get the right area. So an exotic vet is the person best to do that. They would probably recommend in her state that they actually remove the ovarian cysts.
What's the risk at her age?
5 is not too bad. For a good vet is actually not too bad. So given that we've got, piggies that are over 10, it's really not too bad. The surgery itself is quite dramatic, but in terms of how she would feel after, her body would feel way less heavy, but way less impact around her ability to breathe and to move. Now, with the meloxicam that she's on, if an animal is dehydrated or not eating well enough, that can have impacts on the liver, which is, we don't know if that's going on. Have you noticed that with the meloxicam she feels a bit better?
She felt better in the beginning, but now...
But not now?
No, it doesn't seem like...
And does she seem bigger to you now?
Compared to
when you first started the meloxicam? Yeah. Okay. Because around here, she's actually really bony. Yeah, I don't know whether you've noticed that. She's very skinny around here. Yeah, so this is all ovarian cysts.
Yeah.
It's really huge. So ideally it would be to get that looked at and removed. Yeah. Just looking at her facial features, she's watering from the eyes.
Yeah, what does that mean?
Well, sometimes if they've got a respiratory condition on board, you can see that a lot from the eyes and from the nose because they're struggling to breathe. I can't hear anything.
Yeah, and the vet, when I went there 2 weeks ago, she said that there was
couldn't hear anything either.
She couldn't hear anything.
Yeah, it's interesting. Has she been doing that for a while?
The eye?
Yeah.
Yeah. Sometimes one of the pigs come and lick her eyes. Is that normal?
Well, they do clean each other up.
Okay.
For sure. And her breathing is really laboured. She's happy to eat though, isn't she?
She loves the food.
Yeah.
If she hears the noise of the stretching, even if she's in pain, she comes. That's why I think if she has the surgery, like she would be stronger.
She would improve. She might do, so just put you this way so we can have a little look in, because you were saying it's the front teeth. You'd notice something?
Bottom.
The bottom?
Yeah.
I'll just get you to sit there, little girl. They're nice at the top. They're okay, they're lovely and neat. They're a bit long. Oh, okay, I see what you mean by the discoloration. Yeah, okay.
It had one there, and then it dropped.
Yeah.
And then started growing. And
Okay. So she lost a tooth and then had one grow back again.
yeah, that's the new one back.
It's easy to leave. I don't want to let her struggle with her. If you just keep her there for a minute.
Yep.
That's better. That's better. We can show everyone your teeth. So she lost her tooth on the bottom right, and you can see the discoloration there halfway up. The top teeth look really lovely and white, and they're nice and even, which is great. And the discoloration, usually as teeth grow, they show their age or problems. So as they grow up, we're looking at the problems that occurred more recently. Let's have a look around here. We'll just put her side on so everyone can see. When they do start to have ovarian cysts, they go symmetrically bald, and so it's showing. You can't see it from the top, but you can see just underneath here. And if I turn her round, you'll see the matching side. So it's another indicator of a hormone imbalance due to the ovarian cysts. It's another reason it needs to go. But underneath, we'll just take a little look so everyone can see. Can you see her there? What her little tummy is looking like, and how big it is. She's so heavy. Okay, imagine that little girl. Because she's got some discharge there, a low-level antibiotic might be useful for her. But the more urgent is the ovarian cysts that are so huge at the moment. You poor little girl. Her ears that you asked about, but they're a little bit dry and hard, but it's really because of her eyes. She's grooming her face, and then she'll just be pushing it up towards her ears. So it's nothing that's, overly a problem. I don't want to stress her too much. She's like, what are you doing? But yeah, just every now and then just wipe that out. Her eyes are very runny in the corners, which, is something. Thing. Yeah, ovarian cysts are really serious when they're like this. And that's just.
Oh, that was a bit.
There's a bit manky, isn't it?
Sorry.
You can feel it on the ears. It's okay, it won't. It's, dead, dry skin with a waxy surface. There's no fungal on her.
Okay, that's good.
But this is typically where it will harbour, if it is. And given that she's got these weepy eyes at the moment, which, it's indicative of a respiratory infection or something going on. ears actually don't feel warm. Now, if she had a systemic infection due to the starting to erupt, we would actually feel her warm all over. And there's no particular warmth down here either. Oops, I actually don't think that's happening. Yeah. She's hunching up quite a lot. Like we need to get those out, don't we? This breathing. She's such a little rib cage. Wanting to sit down, aren't you? Why? She doesn't want to sit down now. You can completely put your hands under there. So she's carrying her own weight.
Most of the time she's like that.
Standing?
Just
Okay.
like this. Yeah.
Yeah, she's actually carrying her full weight. Come on, sit down. Let's see if I get you to sit down. Which is unusual. Open off that little gunge off your eye. What you can do, that's not going in her eye, but just in front where she's gathering all that muck that's coming out. We're just going to move that away anyway, so she's not then taking it up to her ears. I think she needs a low-level antibiotic because her respiratory, even though we can't hear anything, her respiratory is really heaving. She's got massive ovarian cysts on board. It's impacting her lung capacity, which is here. She's got her tummy on the ground there now. She had it on the ground. But she's got this discharge. Okay, so we have done a recheck with this little lady, and while the vet didn't think she has respiratory, when we listen in through this left lobe of her lung, she definitely has a crackle in there. So she's heading back to the vet where she can get some antibiotics, and it's actually in line with the breathing. Although the cysts are so large and it impacts on this area a little bit, we wouldn't expect such labored breathing. She has the discharge from the eyes, which we've cleaned up, and that's in line with, again, a respiratory infection. So yeah, I'm really glad that we took a second listen, because if you listen in this area you won't hear it, but it's definitely over on the left lobe, and definitely a crackle. When you hear a crackle, that can be a low level or even a severe pneumonia. So, you know, without antibiotics, this little girl will be in more serious trouble. She's 5.5 years now already and compromised with these ovarian cysts. So as soon as she can get onto that, the better. Awesome. That's it from me. Make sure you like and subscribe, and also click the notifications bell up above so that you can be notified when we release more interesting videos for you. Take care and give your piggies a big hug. Bye.